Have you ever stopped to think about what really happens to your body during sex? We are not talking only about that explosion of pleasure, but about all the physiological processes that occur while you are busy in the most intimate activity that exists. Get ready to dive into a fascinating world of trivia about what rolls under the sheets. Remember that moment of intimacy that comes the famous question, was it good for you? It's interesting to note how men and women often have different reactions. While some men tend to be calmer and more relaxed, even falling asleep, some women prefer a little more emotional connection post-sex, a cuddle or a conversation. Why does this happen? These differences may be influenced by biology, individual emotional needs, and social expectations regarding postcoital behavior. That's why it's important for partners to prioritize communication, be empathetic to their partner's needs, and find a balance between relaxation and emotional connection. By the way, did you know that on average people have sex about 80 times a year? But, of course, this can vary greatly according to culture, lifestyle, and even gender. Statistics show that in general men tend to think about sex more often than women, but this does not mean that they are having more sex. But is there an ideal frequency to have sex? Recent research has suggested that the optimal frequency of sex may vary between individuals, but a study published in the Archives of Sexual Behavior revealed that, on average, once a week seems to be sufficient for marital happiness. For women, this may be related to the production of oxytocin, the love hormone, which is released during orgasm and promotes feelings of intimacy and emotional bonding. For men, frequency can influence prostate health, with studies suggesting that frequent ejaculations can reduce the risk of prostate cancer. Let's talk a little more about this alteration that sex makes in our bodies. Emotional and psychological aspects of sex. During sex, the brain releases a cascade of neurotransmitters, including endorphins and oxytocin, which provide a feeling of euphoria and well-being. These neurotransmitters not only relieve stress and anxiety, but also strengthen emotional ties between partners. However, it is important to note that the emotional experience of sex can vary widely between individuals and depends on a number of factors, such as relationship status, past experiences, and personal expectations. Orgasm and its effects. Orgasm is the culmination of sexual pleasure and plays a crucial role in physical and emotional well-being. During orgasm, the body releases a burst of hormones and neurotransmitters, including oxytocin, dopamine, and prolactin. These compounds not only provide an intense feeling of pleasure, but also have beneficial health effects such as reducing stress, strengthening the immune system, and even relieving pain. In addition, orgasm promotes a feeling of relaxation and satisfaction, which can significantly improve mood and sleep quality. Pain relief. Sexual activity can have natural analgesic effects for both sexes. During sex, the body releases endorphins, which are neurotransmitters that have natural analgesic properties. These chemicals can help reduce sensitivity to pain and relieve discomfort, both during sex and in other areas of the body. Cardiovascular benefits. Sexual activity increases heart rate and improves blood circulation, which can help reduce the risk of heart disease, such as hypertension and atherosclerosis, in both sexes. During sex, physical activity and increased arousal promote better blood circulation throughout the body. This not only improves the delivery of oxygen and nutrients to the tissues, but can also have positive effects on cardiovascular health in the long term. Stimulation of the nervous system. Sex stimulates the nervous system in various ways, resulting in physiological responses such as increased heart rate, accelerated breathing, and dilated pupils. These nervous system responses are integral to the sexual arousal response and contribute to the overall experience of pleasure and intensity during sex. Promotion of hormonal balance. Sexual activity stimulates the production and release of a variety of hormones, including testosterone, estrogen, and progesterone, which play key roles in regulating mood, sexual desire, and reproductive function. We must also mention gender-specific changes. Let's talk about women first. Erection of the clitoris. Just like the penis, a woman's clitoris can also become erect during sexual arousal. This is due to increased blood flow to the erectile tissue of the clitoris, resulting in a noticeable erection. The erection of the clitoris is an important part of the female's sexual response and contributes to sexual pleasure and orgasm. Vaginal lubrication. Vaginal lubrication is a physiological response to sexual stimulation and is crucial for comfort and pleasure during sexual activity. During sexual arousal, the Bartholin glands and the smaller vestibular glands produce a clear, viscous fluid that lubricates the vagina and facilitates penetration. Elevation of the cervix. During sexual arousal, the woman's cervix rises inside the vagina. This creates additional space at the bottom of the vagina, allowing for deeper penetration and increasing the feeling of fullness and pleasure for both partners. Increased blood flow to the pelvic region. During sex, a woman's body experiences a significant increase in blood flow to the pelvic region. This increased blood flow results in a natural lubrication of the vagina, facilitating penetration and increasing sexual pleasure. In addition, the uterus rises during sexual arousal, providing additional space for penetration and intensifying the feeling of pleasure. Pelvic floor contractions and orgasm. During sexual climax, a woman's body experiences rhythmic contractions of the pelvic floor muscles, known as orgasm contractions. These contractions are an integral part of the female orgasmic experience, increasing pleasure and strengthening the pelvic muscles. Studies show that these contractions can also have beneficial health effects, improving bladder control and preventing problems related to urinary incontinence. And how many to men? What happens? Let's talk about men with me. Penile tumescence and erection. During sexual arousal, a man's body goes through a process called penile tumescence, in which the penis fills with blood, resulting in an erection. This phenomenon is mediated by the action of the neurotransmitter nitric oxide, which relaxes the blood vessels in the penis, allowing an increase in blood flow and consequent erection. Increased testosterone production. Male sexual activity is associated with an increase in the production of testosterone, the main male sex hormone. Testosterone plays a crucial role in regulating sexual desire, erectile function, and sperm production. During sex, the release of testosterone can temporarily increase, contributing to a more satisfying sexual experience and increasing male sexual desire. Muscle contractions and ejaculation. During male orgasm, the body experiences rhythmic contractions of the muscles of the pelvic floor and genital area, which culminate in ejaculation. These contractions are an integral part of the male orgasmic experience, increasing sexual pleasure and facilitating the release of sperm. Studies have shown that regular ejaculation can have beneficial effects on prostate health by reducing the risk of developing diseases such as prostate cancer. Finding a balance that works for both partners is essential to the overall well-being of the relationship. During sex, the body undergoes a number of incredible biological and mental changes. And there's no set amount of sex that makes a relationship great. It's normal for two partners to have different ideas of how much sex they want, but what's important is that couples work together to find sexual pleasure that works for both of them. Did you like we talk in this video? Leave your like, subscribe to the channel and activate Sinho to receive everything firsthand. Don't forget to leave your comment for us with further improve. Remember that if you identify any discomfort in your body, be sure to look for a specialized professional. Take care of your body and mind and do not neglect yourself, not even for your partner. Thanks for watching and see you in the next video.